Welcome back. Fox 8 News in the morning. New studies suggest COVID-19 patients could experience heart issues even after they've recovered. Heart surgeon Dr. Mark Gilinoff from the Cleveland Clinic joins us now and has more on this recent study. Doctor, first of all, thank you very much for taking time out of your busy schedule to join us this morning. Let's talk about this study. First of all, wow. Do you agree with it, or what's your reaction to it?
Well, the data is pretty clear. There are a couple of studies now that show two things about coronavirus in the heart. The first thing is if you already have heart problems, including just something as simple as high blood pressure, if you already have heart problems and you get infected, you have greater risk of complications. We knew that. The new finding is that the coronavirus can cause heart problems in people who never had any heart issues before. The virus can actually get into the heart muscle tissue, affect the cells, and cause inflammation.
Now, when that happens, I mean, is it something that just is it chronic, or can the heart fight it off? I mean, why is this happening? That it's happening long after the COVID-19 is gone?
In most people, there are no symptoms, and they do fine. And if we look at the heart on either MRI or by actual biopsy, we say the virus is there, but it didn't do much. That's most people.
Most people, yeah.
In some people, the virus causes something called myocarditis, which is an overwhelming inflammation of the heart muscle, and that can actually cause heart failure and even permanent damage. And as is the case with a lot of elements related to the virus, we don't know exactly why this happens. There's so much new, and the generation of new information about it is constant every day, but we've got a lot more to learn.
We have a lot more to learn. Just to get your opinion, and we talked about this just a second ago, what's your reaction to starting school this fall when it comes to students?
When I consider starting school from a health perspective, I think it's a terrible idea. And there are going to be some kids who get sick. There are going to be some kids who die. There are going to be some kids who take it home to parents and grandparents. And the calculation, how many people are going to be allowed to die in order to get kids to school, I just can't see that equation. My answer is none.
Yeah. Well, first of all, on a brighter note, Cleveland Clinic, once again, #1 in the nation when it comes to heart care, and #2 overall. Congratulations to you guys over at the clinic.
Thank you. Thank you very much.
Yeah.
We're very proud of that and honored.
Yeah. Talk about why are we so good when it comes to heart issues at the clinic? What makes us so good?
That's a much easier question than coronavirus questions. The answer to that is the people and the teams.
Yeah.
The doctors, the cardiologists, the surgeons, the nurses, the people who help us take care of patients. It's like having an all-star team year after year after year. And the way people work together and their commitment, it's just remarkable. I visit hospitals across the country every year, and I've never seen anything like it. We're really lucky in Cleveland.
Yes, we are blessed, no doubt about it. And you are a very, very important member of that team, and we are awfully glad to have you as one of our contributors here on Fox 8 News in the morning, Doc. Thank you so much, man. Keep up the good work.
Thank you. You too. Bye-bye.
Bye-bye.